Hi, my name's Brett Shore. I'm an orthopedic surgeon and sports medicine and hip specialist. I'm originally from Philadelphia. I did my undergraduate training at Princeton University, a degree in molecular biology. I then went to medical school at Columbia University. I did my orthopedic residency at the Harvard Combined program in Boston. And then I did my sports medicine subspecialty training with Dr. James Andrews in Birmingham, Alabama. And then I moved west for a position as a hip specialist within Kaiser Southern California, and have spent the last 9 years as the head of hip preservation for Kaiser Southern California. My experience lies with sports medicine, shoulder, hip, and knee, and more specifically, I'm a hip specialist, meaning that I provide any kind of service available for the hip. I take care of patients ranging from teenagers who have hip dysplasia and who have hip impingement, all the way up to older patients who have hip arthritis and who need hip replacements. I take a holistic approach to the patient, and because of my position as the head of hip preservation for Kaiser Southern California, I have been the go-to hip specialist for a population of about 4.5 million people for about the last 10 years. And so the breadth of pathology that I've seen and my surgical experience is relatively unique. My practice philosophy is something that has sort of evolved over time, and I've come to appreciate that keeping patients moving and active and out of pain is paramount to their health, both physical and mental. There are two main areas that I've found the most rewarding in my practice. The first is when I see patients either at their last follow-up, or I get a note from them, sometimes a picture of them doing the activity that they love, and thanking me for getting them back to the activity that they weren't sure they'd ever get to do again. The other thing that I've found particularly rewarding, having the ability to improve an outcome, not just in a patient who's never had surgery, but in a patient who has had an unsuccessful surgery and is understandably discouraged by the whole process, is incredibly rewarding. My free time is spent in ways that match my patient philosophy. I am very active. As a family, we do a lot of hiking. Snowboarding is one of my passions, and I spend most of my time when I'm not at work with my amazing family. My wife, who is our medical director here, and my 3 wonderful daughters. I'm excited to partner with DISC in the formation of our hip center in order to maximize patient outcomes through extensive collaboration and unparalleled patient care.